Thank you, Mr. Pooran, for accepting our request of the Ethiopian Veterinary Association to share your ambition, your vision at our 50th anniversary. Please introduce yourself and how your work inspired the UN Sustainable Development Goals.
Well, thank you very much to the Veterinary Association for inviting me to join you on this great occasion. Yes, my name is Pooran. I've been working in sustainability for about 35 years or so now, but my background is actually in neuroscience and medical sciences. So I studied medical sciences at Oxford. I was in neuroscience research. Then I went into medical school at Cambridge. In fact, I only did a couple of years, so I didn't finish my medical training, and co-founded an environmental organization called Bioregional in 1994. And with colleagues set up a couple of sustainable forestry businesses, a couple of organic farms, a couple of recycling businesses. I needed new offices, so we ended up building the world's first zero carbon urban village development called BedZ in South London, which was 100 homes and about 2,000 square meters of community and commercial space. So I lived there for 18 years, worked there for 18 years. I coined the term One Planet Living. How can we lead happy, healthy lives within the environmental resources of our one planet, with 10 very simple, universal, intuitive guiding principles for sustainability. So those were from health and happiness, culture and community, equity and local economy, through to zero carbon and zero waste. And we applied those 10 principles around the world across all sectors. So we worked with manufacturing companies, we worked with retailers, we worked with real estate developers. So I led teams writing sustainability strategies for about 30 billion US dollars of zero carbon development around the world. Everything from tiny homes in Australia, new quarters of cities in the Middle East, settlements in West Coast America, landscape scale conservation and development across Africa, the extension to Disneyland Paris as well. So a whole One Planet resort, which is Europe's largest swimming complex, all geothermally heated, 1,000 holiday apartments run on renewable energy. More protected species after development than before development. So these projects, very inspiring projects. We also wrote the sustainability strategy for the London 2012 Olympics. So that was called the One Planet Games. And my colleagues then teamed up with the Colombian government in 2011, brought together all these inspiring projects and started a process which ended up in the UN adopting, all member states adopting the UN Sustainable Development Goals in 2015. So I'm very proud that 10 One Planet Living principles, which I led on creating, ended up inspiring and being the basis for the 17 UN Sustainable Development Goals. And I think the reason for that was we created a universal, holistic framework. And so we have to see the big picture so that we can see how our own small actions can come together to create something which is more than the sum of the parts, that we can all see how our small actions can come together to really create a sustainable future or regenerative future for us.
Very good. Well, that's really great and inspiring. I'm sure the audience will be inspired by your initiative. Why have you now built OnePlanet.com?
So this is a very interesting question. We were looking at how could we scale One Planet Living and the UN Sustainable Development Goals, and how could we bring a different way of thinking? So it's taken me on a very long journey. I've had to unlearn everything I learned at school, unlearn everything I learned at Oxford University, unlearn everything I'd learned through Cambridge, unlearn everything I had learned over my working life. Because it turns out that there are two very different ways of processing information. And those two different ways of processing information are represented with the two different halves of our brain. So this is the work of probably the greatest thinker of our time, called Dr. Ian McGilchrist. He's a psychiatrist, neuroscientist, philosopher. But we've made a massive mistake in European culture, which of course has become global culture, in that we see the whole world in terms of its parts. And we think the more we know about the detail of something, the better we are at managing the whole. And that turns out to be a incomplete and problematic relationship with reality. So the whole scientific reductionist materialist paradigm is fundamentally problematic, because actually, ultimately, the world is totally interconnected. And it's one living organism. Our planet, and in fact, probably the universe, is one whole living organism. And all the time we divide it into its parts, we are not dealing with the ultimate truth of existence. So we have to see things as very interconnected, and that uses a completely different part of the brain. So that uses the right half of our brain, not the left half of our brain. So we have spent 300 years in say the European Enlightenment, if you like to call it, focusing on words, numbers, but the ultimate reality is beyond words and numbers. And this, for example, expresses itself even in how we deal with medical issues. So my background's in medical sciences, so now we realize that 80% of medical spending in the UK medical system actually is avoidable. That 80% of all disease in the UK is now primarily caused by or determined by the diets we eat, the lifestyles we have, whether we have a clean environment or not. So we have to now start thinking very holistically, and we have to think about how do we promote healthy ways of living, and ways in which we can live healthily as individuals, healthily as communities, healthily as whole ecosystems, and ultimately healthily as a whole planet. So we have to move away from medical intervention as our primary tool to actually promotion of health. And promotion of health and treatment of disease are two things which have very little crossover. And we have to see ourselves as part of a whole living organism, a whole living planet, and that's very different. And that's why we've ended up building the OnePlanet.com platform. We use very different database technology. They're two fundamentally different types of databases. The SQL type databases, where everything is held in separate cells like an Excel spreadsheet. And then there are these what are technically known as graph databases or network databases, where all the information is held on the basis of its interconnectedness. And in fact, the two languages you require to process that information is completely different. And so it's like the two halves of our brain. One part of the brain sees everything as separate parts, the other sees everything as an interconnected whole. And so we have created OnePlanet.com as a technology which enables us to understand interconnectedness and then collaborate around what we call shared outcomes and coalesce to a planet regenerating state. And I talk about a planet regenerating state because actually the planet is half as alive as it was 300 years ago. So if we weigh the amount of living matter on the planet, there's half as much as there was 300 years ago. So our challenge is now to regenerate our planet and to regenerate it in a way which promotes our health and the resilience, our health resilience. It promotes the resilience of our communities. It promotes the resilience of our economy locally. And I think we'll have to move to very much more local economies. We have to move away from a globalized economy to a much more local economy, and in ways which generate and regenerate our local ecosystems and ways which then ultimately regenerate our planet. So I think it's a very big challenge. I like to say that we have 10 years to transform ourselves from a consumer society, which has consumed half of all living matter on the planet, to a regenerator society or even a regenerator species. So we have to think of ourselves very differently in terms of our place on this planet, and we have to reassess the science that we've been brought up on, start looking at the latest science in terms of system science, life science, which now is very clearly telling us that systems do not just arise from the parts. The whole systems determine how parts behave. Parts don't just determine how systems behave. So there's a whole flow of information, which I think we can talk about in terms of system science, and move this away from our obsession with reductionist science. So I think we're on the verge of a massive paradigm shift in terms of how we have to start seeing the world and how we start working with the rest of nature.
Very good. I think I am learning. I'm sure my audience will be also learning. That is mission completed. When we set one health, one welfare, one planet as well our theme for the next 50 years, I am sure the way we educate our professionals, the way we also re-engineer our veterinary services, our policies should be revised in a way that we go out of our silos and work with, as you say, systems that demand system change. And you said. You say now that you have to build resilient, regenerative communities. And why and how do you say how do this? Because building resilient, regenerative communities from local as well as international is challenging because of the pressure of globalization.
Yes, I think, Bojia, this is a very interesting question. I think we are moving away from globalization already. We're seeing protectionism come into play. So countries are starting, we're seeing, say, trade wars between the US and China. We are seeing local communities all around the world very undermined by globalization. So we see it creating more and more social inequality. And certainly in the UK, we are finding that there are fewer and fewer very rich people, and most people are struggling to survive. We have a massive mental health crisis in the UK, particularly amongst young people. I don't know what it's like in Ethiopia, but in the UK now, young people are struggling with their mental health for all sorts of reasons, because we have created a society which, on the one hand tells them they're not good enough. When we try, for example, I would say all our advertising, all our social media is actually trying to sell people, and particularly young people, things. But you sell people things by telling them that their life is not good enough. That they're not good enough. They need to buy something new to be good and to be better. So the whole consumer society that we've created is actually creating a huge amount of mental ill health as well. And so we're seeing a mental health crisis. Of course, we are seeing a climate crisis. So around the world, we're all getting hit by climate disasters. Here in the UK, we had 18 months of the wettest weather on record. So our crops are down 25%. And 70% of our farmers don't think they will survive the next 18 months. We have our Department for the Environment saying that they are expecting a collapse of our total food and farming systems for environmental reasons, climate reasons, within 10 years. So we're hitting a agricultural crisis, a farming crisis. We have a social crisis. We had riots in the UK. We have huge amounts of debt. Of course, we have political instability. Around the world, we're seeing water problems. We're seeing how extreme flooding is making homes uninsurable. in the UK, but we see it in the States, across Florida, say, across East Coast America, but then wildfires, West Coast America. So the whole global system, and of course, if the American real estate industry and economy comes under huge amounts of pressure, I don't know how the US economy can survive those sorts of pressures. China has just made food security its #1 issue because of extreme weather and flooding. So we are seeing massive environmental problems. I'm going to say we are actually in climate and ecological collapse around the world, and that is going to drive us away from a global economy to a much more localized economy. And this is going to force us to come together locally to look at more local energy, more local food, build local community resilience by coming together. I think we'll have to look at more regenerative agriculture. We'll have to look at health, promoting resilience in health through good diets, good lifestyles, community connection, and move away from medical practice. And in fact, in parts of the UK, our water is becoming undrinkable because of the amount of pharmaceuticals in the water. From people taking medication, whether that's for diabetes, for mental ill health. So there's so many antidepressants in our water at the moment that we're drinking now. Our water is drinking a cocktail of pharmaceuticals. We are seeing, for example, now massive problems with our insect populations, partly caused, for example, by veterinary medicines. So looking at things like flea treatment, treatment for fleas, that now is ending up in the water and persisting in the water and creating problems for aquatic life and insect life. So we're going to have to change almost everything that we do in our lives and start looking at not treating problems, but looking at promoting health. So not tackling the problem of climate change, but living in a way which creates a stable climate. Not looking at treating disease, but looking at ways of living and producing food which actually promotes our health. So I think there's a fundamental shift in the whole way we perceive the world and attend to the world, which is required for us to really ultimately regenerate the planet. And I think that is one health, that is one welfare, and that is ultimately one planet.
I'm sure that is. Ethiopia is not immune to the crisis. You have taken UK as an example and reflected on. We have also social crisis, ecological crisis, climate crisis, natural shocks, which affect us, the climate, the environment, and then the life on the planet, the animals, and then human. I'm sure we learn as a country, as a nation, from the initiatives you started to promote resilient, regenerative communities. Now let's talk about our profession, where the veterinary profession stands in this initiative. How can the veterinary profession be part of creating resilient, regenerative communities?
So of course, veterinary profession is going to be very important. Look, I almost studied veterinary science. I was very close to applying for veterinary science because I have a love of, and it started love of nature, love of animals. I was born in London, but first 3 years brought up in Africa, in Malawi. And I think a lot of people brought up in Africa end up with a love of nature. We had a big garden, lots of animals in the garden, lots of dogs, and I think that love of the rest of nature, because we are part of nature, I think is something which veterinary surgeons have, of course, and I think that that's going to be important. I think what veterinary surgeons are going to have to do is learn the limitations of the reductionist scientific paradigm with which we've been brought up, and start seeing that actually we are part of one living planet. and that actually a reductionist view rather than a holistic view is very problematic. Of course, there'll always be need for some treatment, diseases to treat, but actually we got to look at promoting health in livestock as well, but wider nature as well. So we'll have to start with ourselves, re-educate ourselves, and I think what that will mean is, of course, look at a future where we're cutting down on the amount of livestock that we have, leaving space much more for wilderness and wildlife and rewilding, of course, which is a big movement. Because now, if we weigh mammalian biomass on the planet, 96% is humans and human livestock, and only 4% is wild animals. Now, that is a totally unbalanced planet. So I think we'll have to move to much more plant-based futures, much less livestock. You know, I think maybe there's a place for eating smaller quantities of high-quality meat, but there's probably huge amounts of opportunity for getting involved in things like rewilding and supporting a concept of human and animal health, which is not about treating disease. It's about seeing ourselves as part of healthy systems, healthy local ecosystems, parts of healthy local economies, resilient local economies, parts of then ultimately part of a resilient, healthy, regenerative planet. So we'll have to re-educate ourselves and redirect all our professional knowledge towards resilience, a salutogenic future, a health-generating future, and that will be very different from the last 50 years.
Very good. I always at this occasion I have invited professionals from the human health, who is also speaking, one of the keynote speakers, and also from the climate specialist, and also from Biodiversity Institute, and also, of course, veterinarians in the room. The way I think is, I think we need to be in the room to formulate how we educate our next generation, how we formulate how we also work, and how everything fits together, because nature was perfect from start. It is us, the human being, who now are, as we specialize, we move away, not coming to the room to talk and then to join the dots of our minds, our experiences, to solve problems. But the question is, the way now the planet is dying is really faster than the initiatives, people, visionary people like you, are bringing together people around the table to talk and then leave a legacy, a good future for the next generation. So I really appreciate your initiative, and I'm sure there are many things, as you said, we would learn as professionals and try to work together. But I have seen it's not an easy one, because people never leave their silos and come to work together. I think you are the best example to go to school and then leave, and now you have the perfect position to solve the problem, at least to leave something to contribute to solve nature.
Thank you very much. I mean, I want to say, I think there are ways of helping people out of their silos. We have to reactivate the right half of our brains, which can see the bigger picture and which can get us out of our silos. So we have launched a global OnePlanet movement using our technology to help people collaborate across different silos and see the bigger picture. So absolutely would love to work with the Ethiopian Veterinary Association to get that into Ethiopia, into the profession, and work with you to turn things around, because we have got very little time to do that, as you say, and would love to work with you to do that.
Thank you very much. Thank you, Mr. Pooran, to have you on behalf of the Ethiopian Veterinary Association and the members of the executive team. I would like to thank you, and we are very grateful for your time and for your knowledge and for your initiative. Thank you.
Thank you very much. Thank you.